Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ria Cotrillo. Today on the program, with the now more manageable COVID-19 situation, will President Bongbong Marcos extend the state of calamity? Millions of COVID-19 vaccines remain unused, with fewer Filipinos taking booster shots. And the health chief post remains vacant, but a DOH executive says she's ready to take on the job. Health officer in charge, Maria Rosario Vergeire, joins us live. No decision yet on the extension of the COVID-19 state of calamity. Before it lapsed in December, President Marcos expressed hesitancy in continuing this status. But the DOH earlier sought its extension to allow the continued implementation of measures to fight the pandemic. Let's go straight to the source of the story. Health officer in charge, Maria Rosario Vergeire. Ma'am, good morning. Thank you for being here.
Yes, good morning po, ma'am, and good morning to all of you.
Now, the health department logged an average of 36 new cases on February 5. Would you say that this is the lowest COVID count since March of 2020?
Well, yes, we can say that this is the lowest among this number of days that we had been monitoring. But we have to remember that we are not capturing the entire number of those who are getting sick now, because most of our citizens are already using the rapid antigen test.
So with this, I mean, we do assume there still is a general decline, even if the 36 doesn't reflect the true number. Are you inclined to recommend to not extend the state of calamity?
Well, for now, the state of calamity has lapsed already based on the EO that has ended last December 31. We have requested from the Office of the President for further extension, but this was because of technical matters. It's not because of the situation, but the different conditions that had been hinged on the state of calamity executive order. So for now, it seems like the President really is very hesitant in extending. The Department of Health is already doing countermeasures or parallel measures so that we can be able to manage the conditions that had been hinged with the state of calamity.
So, ma'am, when you say technical matters, what exactly does that mean?
Well, first of all, the procurement of the COVID-19 vaccines, the facilitative or expedited procurement is hinged on the state of calamity executive order. So now that there is no state of calamity, we need to revert back to our usual way of procuring our medicines and technologies like vaccines through RA 9184. And this will take time, not unlike before that we can readily, and there is this negotiated procurement under emergency measures. The second one would be the indemnification that has been hinged also in the executive order. This is part of the requirements of the suppliers or manufacturers in order for them to be able to facilitate the contracts of our procurements. And the third, of course, would be the liability, the immunity from liability of our healthcare workers when they have this, when they do their vaccination.
So, ma'am, just to clarify, there is no longer a state of calamity since this lapsed back in December, correct?
Yes, that's right.
All right, Yusek, when was the last time you discussed this topic with him, this issue of extension or non-extension of the state of calamity? When can we expect a decision, or is that decision already final?
I think whether the president decides or not, or announces it or not, the fact of the matter would be that it has already lapsed last December 31. And until he would be extending this through an official executive order or policy issuance, the matter remains to be the same, that it has lapsed already and there is no state of calamity. Last Wednesday, we had a meeting with him, and through our discussions, I think that would be the direction already of the Office of the President.
What else did you discuss with the President, ma'am, during that meeting on Wednesday?
Well, we discussed about the healthcare workers allowance, that he instructed us that it would still continue until the public health emergency status is here. And also we discussed about the procurement of the bivalent vaccines.
So, ma'am, now that this has lapsed, what exactly does it mean for our COVID-19 response? Will it be that much more difficult for you to procure what is needed to fight the pandemic or the end of the pandemic?
No, not at all. I think these conditions are mainly for the vaccination. As to the response, we had been gradually easing our restrictions for these past months already, and I think we had been successful because we were able to manage our situation. Especially our hospitals are now manageable. We are better prepared than the previous, so I don't think that this extension of state of calamity or non-extension would be a matter in this COVID-19 response that we are doing.
Ma'am, speaking of restrictions, are there any other restrictions you want to remove or are studying to remove at this time?
Well, at the moment, we have minimal restrictions already. What we have right now, I don't want to call it restrictions anymore because these are just safeguards for us. Like what we do in our borders where everybody can go in as long as you are vaccinated. But if you are not vaccinated, you need to go through the testing. And also, if you are found to be positive, you need to isolate for a number of days based on our protocol. In our communities, everything, the borders are open already. We just need to do strengthened surveillance so that we can be able to capture those who are getting sick.
Ma'am, what about the World Health Organization's decision maintaining the public health emergency status of COVID-19? Like for the part of the US, they said they're going to lift the status by May 11. Should this kind of consideration be made for the Philippines as well?
Well, that consideration has long been part of the plans of the national government. As you may see, we have gradually eased our restrictions because we would like to move forward from this COVID-19 situation. The difference would be that we cannot give a specific time as of this moment because there are no certainties yet because there are new variants that are incoming and we would like to better prepare our healthcare system. But eventually we will have that also.
All right.
The public health emergency announcement of the extension of public health emergency of international concern of the WHO is a guidance for countries. But if and when the country will decide that they will end this public health emergency, the countries, even us here in the Philippines, have that authority.
So, ma'am, speaking of these new variants, what variants do we know are here in the Philippines now?
Well, among the newer variants that had been detected in the different countries of the world, what we don't have right now would be the XBB, which had been identified in the US recently, where it's causing the increase in the number of cases. As to the variant from China, the BF.7, it has already been detected here last July, and the other variants as well. The predominant variant in the country would be still the BA.5.
All right, the BA.5. Ma'am, as we know, thankfully the cases are going down, but are there any areas of concern within the Philippines?
Well, there are certain spikes in some areas of the country, but these are all non-significant at this point. What we are trying to have our citizens understand would be cases would always be there. That would be expected because the virus is still here. What would be most important for all of us would be our hospitals, our healthcare system. And as long as our hospitals are having manageable cases, then we are good. So I think the situation is very manageable at this point, especially that our hospitals are not being filled up by COVID-19 cases.
All right. And ma'am, could you give us an update in terms of the new variants? How many of these cases have been reported?
Well, in terms of the variant from China, the BF.7, we were able to detect 4 cases. The very first case that we had been able to detect was last July of 2022. So when the news broke regarding China's surge and the new variant, that was around October or November of last year, the variant has been already detected here in the country. Although, of course, there was this late detection because of the genome sequencing that we have done.
Now let's talk about the hospitals, ma'am. Cases are more manageable. fewer cases at least, so hospitals aren't so stressed. But what about the severe COVID-19 cases? How many of those are we seeing at present?
Well, at present, we have nationally, we have around 500 plus cases of these severe and critical COVID-19 cases, and they are scattered across the country. Trying to look at that and comparing from the previous months, we are at that plateauing stage where it's not increasing and it is staying at that level where it's minimal, and we can be able to manage that.
All right, I want to talk now about COVID allowances, which you also touched on earlier. President Bongbong Marcos says that COVID-19 allowances will continue, and you had a meeting with him last week about this. How much is the budget set aside for allowances, and how many will benefit from this allowance?
Well, currently in our database, we have 805,000 healthcare workers who are receiving and yet to receive these allowances. So we were able to receive from the national government through our coffers for this 2023 budget a 19 billion programmed funds, and also we have 52 unprogrammed funds. So if you try to add these two together, this would be around 72 billion that had been allocated for the budget for the healthcare workers allowance. This is not enough because we still have arrears from the 2021 implementation and also for 2022. So together with DBM and the Department of Finance, we discussed with the President, and we will have a meeting with the DBM this week so that we can be able to further forecast and be able to identify sources of funds for these lacking funds for our healthcare workers' benefits.
All right, so just to clarify again, ma'am, you said there's 805,000 healthcare workers who are receiving or have received this additional allowance.
Yes, ma'am, that is right. This 805,000 would comprise the local government healthcare workers, the private sector healthcare workers, and also the national government healthcare workers.
So, as you said, there are still arrears and back payments that need to be made to healthcare workers. What are the hurdles in updating the payment of these benefits?
Well, one of the issues that we had been faced, this challenge, because when the law was issued, they included a retroactive application of this law. And the law was issued last 2022, I think that was March. They had a retroactive application from July to December of 2021, and no budget was allocated for that. So that's the arrears that I am talking about, that we still need to pay our healthcare workers.
So, ma'am, is the payment of this benefit continuous or has it stopped?
No, it has not stopped, actually. We were waiting for the President's order, of course, to be very, very clear. But it has not stopped. We are still computing. We are still to pay those arrears also that we have left during the time of 2022. What would be a challenge for us right now would be that the MOAs, or the Memorandum of Agreement with the other facilities, had not been perfected yet. And also some of the facilities, specifically the private sector and local government facilities, have incomplete liquidation of the previous amounts that we have provided. That's why we cannot 100% disburse all at once because of these limitations.
But ma'am, are you able to set a target date for completion of all these payments?
Well, as soon as possible is the target date. But of course, it will depend on the processes on the ground. That's why this week we are going to sit down with DBM because Secretary Amena has recommended some form of measure so that we can avoid delays in the payment. Like, for example, there would be these reforms in how we process our payment, removing MOAs and just having the centrally managed disbursement of funds. And of course, looking at the targets, no? Because sometimes we give a target, but the local government, the private sector, and even our hospitals cannot comply with the timelines, so that the disbursements are being delayed.
All right, ma'am, we do need to take a short break. Stay with us. This is A Source on CNN Philippines. Stay tuned. You're watching The Source on CNN Philippines. I'm Maria Trillo, and our source today, Health Officer in Charge and Undersecretary Maria Rosario Vergeire. Ma'am, welcome back to the program. I want to talk now about the bivalent vaccines. Could you update us on their status and when might these arrive in the Philippines?
Yes, we have already committed donations coming from the COVAX facility worth around 1 million doses. This will, while we are finalizing the different documentary requirements, we are forecasting or estimating that hopefully by the end of March, the vaccines are already here. We also are set to receive a number of doses coming from a government, another country, which already have committed. So we are still trying to negotiate and finalize discussions. And this can be an additional number of doses for our country for these bivalent vaccines.
All right, so we're getting some from COVAX and one from another country. What would be the precautions given to the private sector, given that there has been so much vaccine wastage in the country?
Well, yes, actually, based on the existing law of the country, the private sector can procure through the mechanisms of the national government. But we are strongly advising the private sector at this point to just rely on the national government's procurement so that we can prevent further wastage of our vaccines, since we still have a lot of these monovalent vaccines here in the country, which we can use as boosters for our population.
Regarding the bivalent vaccines, though, ma'am, who will be the first to receive them?
Well, it will depend on the quantities that we will be receiving. So right now, our experts and, of course, the Department of Health are discussing as to the prioritization for the implementation of these bivalent vaccines. But definitely, of course, we will be prioritizing our vulnerable population, and this would be our senior citizens, our healthcare workers, and also those with comorbidities. But again, let me just reiterate, this will depend on the quantities that we will receive.
All right, but on the part of the Philippine government, ma'am, is the Philippine government also procuring bivalent vaccines? I mean, on top of the COVAX donation and this other one that is being negotiated with another country?
Yes, that is the plan. That is really the plan. But of course, we need to go through our A9184 already. So it has to be that there should be the CPR of the vaccines already in order for us to go through our A9184 competitive bidding procurement. So we are now encouraging our manufacturers that they apply for CPRs already through FDA so that we can go through our procurement of these bivalent vaccines.
Now, regarding the unused vaccines, how many are still in storage and usable at this point?
Well, at this point, we have around 26 million doses, around 16 million doses in our national warehouse, and around 10 million doses had already been distributed across the different local governments.
What about expiring vaccines, ma'am? How many have expired, and what is the government doing about this?
Those that had expired would sum up to around 24 million doses. We had been discussing with our teams so that we can be able to prevent further wastage of these vaccines.
All right, ma'am, we do need to take another short break. Stay with us. This is The Source on CNN Philippines. Do stay tuned. You're watching The Source on CNN Philippines. I'm Maria Trillo. Our source today, Health Officer in Charge and Undersecretary Maria Rosario Vergeire. Ma'am, the other day you said that you were ready to become the health secretary. This is different from what you said in the past. What prompted you to make this remark, ma'am?
Yes, ma'am. As I've said and as I've explained during that interview, that I have experienced on the ground, going to the different areas of the country, looking at our facilities, and I think a lot still has to be improved. Also, aligning with the directions of the President during his State of the Nation address, we still need to do a lot. And I think that I can help in facilitating and also achieving these different targets, all in consideration, of course, of these objectives of universal healthcare. But I just like to explain and clarify because I think I am being taken out of context. I am not announcing, and I do not like to preempt the decision of our president. Whatever the decision will be, we will abide with that, and also whoever will be assigned, we will always be supporting, and of course, aligning with the directions of the office of the president.
Yusek, were you actually ever offered the post in the past?
Well, in the past, honestly, I was not offered. I was assigned, and they discussed this with me. And the president said, just stay on and continue work until we can assign somebody. So wala naman pong hiningi sa akin o tinanong. But as I've said, we will always respect whatever the president will decide.
All right. Ma'am, do you have reason to believe or do you have any knowledge of other individuals being eyed as DOH secretary?
There had been some names that had been flaunted or flagged during these past months, but I do not have any knowledge at all who might be the person that they had been selecting or considering.
No, as you said, you met with the president last week. Have you been able to speak to President Bongbong Marcos about your willingness now to be health secretary?
No, not at that time because he was very busy. He was having meetings after meetings. So I was not able to really sit down and discuss with him regarding this matter.
But Yusek, should you become health secretary, what would be your priorities?
Well, my priority would be my access and equity for everybody. When we talk about access, everybody can access healthcare facilities or services as they need it, as they want it, and also equity, that we have this specific focus on the poor and those marginalized, that we can be able to uplift the health status of our poor population so that we can be able to have health outcomes that are equitably distributed across the country.
Ma'am, why do you think it is the president has not yet decided on a health secretary, considering the urgency of guidance needed as we transition out of the pandemic?
Well, that I cannot answer because I think it's the office of the president to answer. But I think that he can see that the healthcare sector is being managed well, and there is this continued cooperation between and among the different sectors of society in support of our healthcare goals.
Ma'am, do you have any idea when an announcement might be made regarding who the next DOH chief would be?
I don't have any idea at all, but as I always say, I will continue to do work and I will continue to support the different directions of the Office of the President as long as I am assigned as the OIC.
Now, being DOH chief, especially at this time, it will come with huge challenges. What challenges do you think a health secretary would have to deal with as we continue to rise out of the pandemic?
Well, as we have said, we are rising out of the pandemic. So there are a lot of challenges because for these past 2 years, having that focus on COVID-19, the other illnesses were set aside. Not really set aside, but the care and the services were really focused on COVID-19. Second, the resources were all drained because we were able to provide and infuse all of these investments and resources for COVID-19. Now we need to be able to start again, refocusing our directions towards looking at the entirety of the healthcare challenges of our nation, not just COVID-19. So this transition from our COVID-19 situation into this new normal that we want would really be a challenge for us right now. We still need the help of all sectors of society so that we can be able to achieve this. The second would be, of course, our vaccination, not just for COVID-19, but also vaccination among our children. As I've said, services were halted because of the lockdowns, and therefore there are a lot of children who have missed their immunization. Second, COVID-19 vaccination, our booster vaccination is still at that low level at 27% of our eligible. So we need to improve on that. And of course, we need to utilize the remaining vaccines that we have right now. third would be, of course, the problem of access to facilities and equity. So alongside with the directions of the Office of the President, we are trying to set up these different facilities which can provide more access to our population.
Right. Well, that is a huge job for whoever will be called to do it. Ma'am, we appreciate your time here on The Source. Thank you very much. That was Health Officer in Charge and Undersecretary Maria Rosario Vergeire. And thank you for joining us here on The Source. Sitting in for Pinky Webb, I'm Ria Tanwat Cotrillo. You're watching CNN Philippines.